Hi, Nicole.
Hi.
Welcome back.
Thank you.
How are you doing today?
I'm fine.
Okay, you're fine. So you're here for another head-to-toe exam.
Yeah.
I know you were here last month. You have immaculate insurance, and it's just a really good plan that you have. So you want to stay on top of your health.
Yeah.
And you're here for another full body assessment.
Exactly.
We're very happy to have you. Can you verify your first and last name and date of birth?
Nicole Carcinello.
Could you spell that?
Carcenellineo.
Okay.
And my date of birth is October 22nd, 1998.
Okay, that's great.
I know.
So, do you have any symptoms that you're experiencing today, or you're just here for the whole head-to-toe exam?
I want that exam, but I've been feeling weird in my feet down there.
Okay.
Like some tingling feeling.
Tingling in your feet?
Like pins and needles.
Okay, that's
So
strange.
It's been very weird in both feet at random times of the day.
Okay.
And then also, like, my upper back has been bothering me. Like, oh,
Okay.
yeah.
So, do these symptoms start together, or do you think that they're separate? Do they start around the same time?
I think they're separate, but it's hard to say. The feet started first, the back number 2.
Okay. And then, again, tell me, how long has this been going on?
3 days.
Okay. And with the feet, so it's pins and needles, it's tingling. Do you feel numb at all?
Yeah, I feel numb after the pins and needles. Like, I can't feel my feet, and so I'll be walking, and then I think, like, am I walking or not? Because I can't feel it.
You don't know whether you're walking or not?
Well, like, I know I am, but I don't know because I don't feel it.
You don't know for sure.
Yeah.
If you're walking or skipping or sitting, that is concerning. And with the back pain, do you remember lifting anything heavy? Because the symptoms you're describing in the upper back, the dorsal muscles, that can a lot of times be attributed to lifting a very heavy object.
Yeah, well, I'm really into my church, so
Okay.
I've just been lifting a lot of spirits lately, but nothing heavier than that.
Okay, so lifting spirits. Okay, so spiritual lifting. So in church, whenever you...
Hallelujah.
Hallelujah.
Amen.
Okay.
Thank you, Jesus.
So you raise your hands a lot?
Yes.
Okay. Do you do this vigorously?
At Mass, yeah.
Okay.
I take part in everything.
And there was never like one church service that you feel like you went too far, or you made a very sudden movement?
I always try to go over the top.
Okay.
So, every service.
Every service?
Yeah.
Okay. Well, that's a great thing to be involved spiritually and to be close to God, and I'm a huge advocate of that. However, we do want to make sure that your body is in shape and that you're not overexerting yourself. Okay. So I'll be doing some examinations with that. Any other symptoms or family history that you'd like to update since last time?
Family history. No.
No.
And the other one, no.
Okay. Any medications that you're taking on a daily basis?
My daily vitamin.
Okay.
Women's Multivitae. That's
Okay.
the brand name.
Multivitae? Okay. Never heard of that one. Okay. How's your sleep?
You know, when I'm at home, sometimes I find it hard to sleep. My mind is racing with thoughts about how I can be more involved with my church and service, and also with my family and my friends. But outside of that, like, I can get 5 or 6 hours of sleep.
That's great. So in terms of racing thoughts, before we go into prescribing sleep medication, sometimes I like to recommend melatonin or valerian root, or a combination of the two that can really help.
Okay, what if it's homegrown?
Homegrown valerian root?
Yes.
I've never heard of it. I've never tried it, but Are you a gardener?
Yes.
Okay, well, if that's...
I would love to garden it if I can.
Yeah?
Yeah.
I don't know where you would buy those seeds, but I encourage you to experiment if that's something that brings you personal enjoyment and fulfillment. Gardening is very therapeutic.
Yes, thank you. I'm very eco-friendly in that way.
Okay.
Reduce, reuse, recycle.
Eco-friendly. Wow, look at you. You are an upstanding member of society.
Thank you.
Okay. If you have nothing else to say or report, I'm going to go ahead and take your vitals just to make sure you're doing okay with breathing, blood pressure, and then we're going to do your feet, followed by a quick cranial nerve exam, and we'll focus on your back as well, okay?
Okay.
Oh, one more question. Are you doing anything for the pain right now?
Meditation.
Okay. So no over-the-counter ibuprofen, Advil?
No, just my home gardening.
Okay. All right. Great. So first I'm going to listen to your heart and your lungs. So just make sure you're in a relaxed space. Uncross your ankles for me. I'm going to start with your heart. Any rapid heartbeat, dizziness on standing? No, that's good. Okay. So just relax. Heartbeat's also normal. I'm going to listen on the bell side, just flipping it over, listening for murmurs or extraneous sounds. Okay, good. Go ahead and just move your arms a little bit. I'm going to listen to your lungs. Okay. Sounds very healthy. I'm going to listen to your blood pressure. Go ahead and give me your arm here. Good. Keep those legs uncrossed.
That's tight.
Oh, I'm sorry. Sorry. Oh, wow. Okay. Release the pressure now.
Thank you.
There you go.
I have this one at my house too, but I never did it that tight before.
Okay. All right. Sorry to bring you discomfort there. Okay, it looks like it's 120/80, so perfect. Very good blood pressure. Just going to slide this off. Excellent. Going to take your temperature.
Okay.
Okay, it's a little high. You're at 100. Do you have any?
Really?
Mm-hmm.
Oh my gosh.
Don't worry about it. It's okay. It's a hot day.
It is.
Are you feeling hot today or feverish or flushed?
No.
Okay. We can double check it later. And lastly, we're going to take your oxygenation by giving your index finger. Perfect. And just we're going to hold it here. Okay, this can't be right. It says your heart rate is 110 beats per minute.
Yeah,
your blood pressure was normal. You don't
nervous.
Okay, all right, so you are nervous.
Yeah.
Well, your oxygenation is normal. It's 96% at room air. Yeah, now it says it's at 112. Wow. There might be something wrong with the machine here. Okay, but we can double check that later as well. Okay. Okay, we're going to do the cranial nerve exam with you laying down, but real quick, I'm just going to feel your face for any kind of contusions or concussions, just because you did mention with your back problems, I want to make sure there's no signs of a fall that you didn't remember. Do you sleepwalk at all?
No.
Okay. Okay, and as I bring my fingers from the bridge of your nose to your ears, do you feel it all the way? So starting now and ending at the ears.
Yes.
Did you feel it on both sides of your face?
Yes.
Did you feel that equally?
Yes.
Okay, we're going to do a little bit lower here. Same thing, starting now. Stopping. Did you feel that all the way?
Yes.
Good. Equally on both sides?
Yes.
Good. And to your chin, starting now. Stopping. Did you feel it all the way?
Yes.
And equal on both
Yes.
sides? Okay. Okay, I'm going to do your forehead now. Starting. Stopping. Okay, good. Okay, I'm just going to feel your thyroid here. Very healthy. Preauricular lymph nodes are intact. And your postauriculars. Okay, very good. Look to your left for me, turn your head. Okay, good. Turn your head to your right. Okay, good. Look up for me all the way. Okay, and look down. Resist my push. Very, very strong. Okay, so go ahead, lay down on the bed, get comfortable, and I'm gonna go ahead and examine your feet. Okay, okay, Nicole. Now, do you mind if I remove your anklet?
It's actually a permanent piece.
Okay, well, I'll leave it on. I'm just going to go ahead and palpate the feet to see if there's any lumps or bumps or inconsistencies that I see within the pads or the toes. Okay, so just lay back and relax. And let me know if you feel any sharp pain.
It's a little numb there.
A little bit numb,
Yeah.
like you're not feeling as much.
Yeah.
Okay. So your rotator here seems to be just a little bit inflamed. I'm going to look with a pen light to see if I notice any discoloration. notice any purpling of the skin. Just want to look in between your toes. Just going to see if there's anything that I see that's alarming here. Okay, now I'm going to just squeeze different parts of the foot. I want you to let me know if you felt once, twice, or 3 times, okay?
Okay.
So this is once, this is twice, okay?
Okay.
All right, I'm just getting an assessment of your level of numbness, so this test should be pretty easy. Okay. Once. Once.
3 times.
Good.
Twice. Once. 3 times.
Good.
Once, I think. Once. Once.
Okay.
Once. 4 times.
Good.
1 time. 1 time. 3 times. Once. Twice.
Good. Okay. Be going on the individual toes, just squeezing again very gently. If you feel any pain, let me know, but otherwise say once, twice, or 3 times.
Once. Once. 4 times. Once. Once. Twice. 3 times.
Good.
Once. Twice.
Okay. Just continue here and palpate the right foot. Don't feel any excessive warmth. I don't feel swelling, which is very good. Just this area right here seems to be a little bit irritated. I'm just feeling a little bit of warmth there, but nothing too alarming so far.
Yeah, I think my left foot is a little bit numb now because I have pins and needles.
Right now?
Yeah, it's been numb for a bit.
Okay. Okay, some slight discoloration. Seeing a little bit of sand here. Did you go to the beach recently?
Yeah, I was at the pool.
Okay. Just going to be putting a little bit of cleanser on the feet before I begin the sensory tests. Okay, it's just going to be a little bit cold. Just want to get rid of any excess debris that might interfere with your responses to the test, okay? Just gonna wait for a while while that soaks into the skin. So you said right now you're just feeling it on your left side.
Correct.
Okay. Going to just rubbing this in with a tongue depressor here. Just getting the moisture. Okay, and just for a brief moment while that settles in, I'm going to do some measurements of the feet just to compare metrics and see if one foot is more swollen than the other, as I suspect the left one is. Okay, you're still comfortable, right? Yes. Okay, good. Okay. Good, this is 11 inches. About a 26 centimeters in the center. Just going to be writing that down. The other side. It's about, okay, so this is 10. We only have about 25.5 centimeters, which means your left foot is a little bit swollen. Just writing that down. I'm going to be going right from here to the toes. That's about 5.5 inches, and it's about 13 centimeters. Okay, and on the other side, it's about, about 13.5 here. So this left foot is taking up a wider area, which could mean that when you're wearing your shoes, the left shoe you feel more constricted in,
Okay.
which results in the numbness and tingling. Now, you said it was happening in both feet.
Yeah.
So I don't know if this is the culprit or not, but just to keep in mind,
Okay.
it might be time to buy some wider shoes just to compensate for that extra surface area.
Okay.
Okay, I'm going to just take a quick sample of some debris right here in the middle of the toes that might be fungus related. I'm not sure. Have you been having any itchiness?
A little bit,
Okay.
but nothing crazy.
So no extreme itchiness, but some light itching. What about any residue, any discharge in the feet?
No.
Okay, that's good. I'm just going to make sure that you're not having a bacterial infection here. Just bear with me. Just going to feel like a little tickle between the toes. Sorry about that. Okay. Just going to get right here. Okay, beautiful. Okay. The next sensory test is going to be vibrational. I want you to let me know when the sound starts and when it stops. Not when the sound starts, when the vibration starts and stops. So go ahead and ignore the sound. And when you feel the vibration on your feet, say started. And when it stops, say stopped. Okay?
Okay.
Okay, good.
Stopped.
Okay. Did you feel it starting?
No.
You didn't feel it starting at all? Okay. All right, so go ahead.
Actually, yes.
So go ahead and say started and then stopped.
Started.
Good.
Stopped.
Okay, you were a little bit early on the stoppage. Just gonna write that down.
Started. Stopped.
Okay.
Started. Stopped.
Okay, I wasn't doing anything.
Oh, really? What?
Yeah, so this is not good for your test. The test just took a turn. It's not going well. It's not going as well as I hoped. But let's go ahead and do it again. Okay?
Started. Stopped.
That's great. Good job. Okay?
Started. Stopped.
Good. I'm just going to lean your toes this way. Good. And again.
Started. Stopped.
Good.
Started. Stopped.
Good. Okay, you're going to move on to the ankle area.
Started. Stopped.
Okay, you were a little bit short there, so I think you are struggling with vibrational sensations, which tells me that you might have a deep tissue issue.
Okay.
Okay,
Started. Stopped.
great. Okay, I'm gonna go ahead and just use a different instrument here. Same test, started and stopped.
Started. Stopped.
Not quite what I wanted, but
Oh,
no, it is what I wanted. I want to assess your level of numbness, but it seems to be pretty severe. Okay.
Started. Stopped.
Good. Okay.
Started. Stopped.
Good.
Started. Stopped.
Good.
Started. Stopped.
Mm-hmm.
Started. Stopped.
Okay.
Started. Stopped.
Yes.
Started. Stopped.
Much better.
Started. Stopped.
Okay.
Started. Stopped.
Good. Okay. We're gonna go ahead with a sharp or dull test, okay?
Okay.
So, do you feel this sensation here?
Yes.
That's a sharp sensation, and this will be soft. So go ahead and say sharp or soft, depending on which one you feel. Try to do your best, but be honest, okay?
Okay. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Soft. Weird soft.
Weird?
Yeah, that was a weird one.
How weird how?
Like a snake.
I felt like a snake.
Yeah.
Was it slimy?
It was soft.
Okay.
Soft. Sharp. Soft. Soft.
Good.
Sharp. Soft.
Good. Okay. So next we're going to do a pressure point test, but I'm going to be using sensory brushes, okay? So you're going to feel either one sensory brush or two. Go ahead and say one or two, depending on which one you feel, okay?
Okay. One. 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 Two.
Okay.
Two. One. Two. 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 One. One. Two. 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 One. Two. Three.
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 Okay. All right.
Two. Two. One. 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 Two. One.
Okay. So that was pretty much inconsistent. Are you okay with laying on your stomach so I can look at the back of your feet?
Sure.
Okay, we're going to go ahead and do that, and I might apply pressure point treatment to just realign some of the tension that I feel, especially in this left leg, okay?
Okay.
I'm going to go ahead and just apply some more of that ointment to the bottoms of the feet. Okay. Just going to be feeling the bottoms. Okay. So is this area numb here when I press?
No.
Okay. What about when I go down here to the very ends of your heels?
No.
No, that's good. Okay. We're going to do the squeezing test again. Go ahead and say once, twice, or three times, okay?
Okay. Once. Twice. Three times.
Okay. I'm going to bring your other foot up.
Twice. Once. Once. Once.
Okay. So I'm going to be squeezing either your right or your left foot. Go ahead and say right or left, all right?
Right. I didn't feel anything.
Okay.
That's right. I mean, I hear your glove, but I don't feel anything.
You don't feel anything? That's the left foot. Okay. So
Yeah, my left foot's really wonky.
Yes, I can tell. So I'm going to be doing some work there right now. I'm going to be using a chiropractic activator tool just to relieve some of the tissue around the area to jumpstart the healing process. It's not going to feel painful at all. It's just going to feel like a pressure. It might feel a little funny, and since you're numb, you might not feel it at all at first. Okay?
Okay.
But do let me know if you feel any pain. Okay?
No pain.
No pain?
No.
Do you feel it at all?
Yes.
Okay.
Oh, I feel the pain there a little.
You feel it? It's been painful?
A little.
Okay, I'm going to go a little bit lighter, but the fact that you're beginning to feel things is a good sign. It means that some of the sensation is returning, which means the tool is doing what it needs to do. I'm just really getting the pressure points along the ankle. Go back to this left one here. I think I've gathered the information I need to gather about your left leg.
Okay.
It's doing pretty poorly, but hopefully the treatment that I applied will be helpful.
Yeah, I think it's already feeling a little better.
Okay, great. So I'm going to go ahead and continue with the quick cranial nerve exam just to assess your eyes and ears, make sure that everything's going good there, okay?
Okay. I'm really excited. I love these exams that you do.
I'm so glad. I'm so glad.
Yes.
I can tell you come back very often.
I do.
Yes. Okay.
Of course. How could I not?
Okay, now go ahead and look at your eyes. Go ahead and pick a point in the wall, stare straight ahead. Okay. Okay. Go ahead and look up for me. Look down. To your left. To your right. Okay. I'm not seeing any jaundice or irritation. No signs of infection or veinage. I'm going to go ahead and look at the other eye and look straight ahead for me again. Look up. Look down. To your left. To your right. Okay. Now look at me. All right. Was that painful at all?
No.
Okay. So I'm going to be bringing my fingers into your field of vision. Whenever you see my fingers, go ahead and say now. Go ahead and stare straight ahead, okay? Good.
Now.
Good.
Now. 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 Now.
Okay, go ahead and look at me. Okay. Let me know which fingers are moving. The fingers on your left or your right?
My left. My right. Both. Left. Right. Both.
Good, okay.
Okay.
Do you have any experience recently with blurry vision, double vision?
No.
No. Okay, so your eyes are doing pretty well?
Yeah.
Okay, I would think so too. I'm going to go ahead and take a Stellan chart and just test that real quick, okay? Look at this chart. Go ahead and read this row for me.
OLCF.
Good. Could you read it backwards?
FCLO.
And that last row?
LTFPH.
Okay, and could you read it backwards?
HPFTL.
Okay. Which number is larger, number 9 or number 8?
9.
Number 7 or number 4?
7.
Number 5 or number 2?
5.
Okay, very good. Okay. I'm going to go ahead and look inside your ears now.
Okay.
Okay. go ahead and look straight ahead. I'm going to look inside your ear for any signs of infection or scarring.
Okay.
Anything along the ear membrane. Are you having any ear pain?
A little bit.
Okay. A little bit. Is it when I tug on the ear, or is it a more inner ear problem?
I think it's inner ear.
It's in your inner ear?
Yeah.
Okay. Are you hearing things that aren't there? Are you
No.
Are you having like a loss of hearing?
No.
Okay. Describe your symptoms then.
I am just paranoid. I think that's what it is. I'm very paranoid.
So how does your paranoia translate to ear problems?
Well, I think I feel it, but I don't know if it's real or not because I get paranoid.
Okay, feel what?
The pain in my inner ear.
Okay, so there's a pain.
Yes.
Okay, so there's a pain in your inner ear. Is it ringing? Is it just a pain? It hurts.
I think it's just a pain. I'm really paranoid.
Okay. I can refer you to a mental health practitioner if you're having some issues with anxiety, paranoia, things like that.
Sometimes, yeah.
Her name's Dr. Katie. She can help you with that.
Is she Katie ASMR?
No, this is a different one. Yeah. And so, but I'm going to go ahead and look at your other ear just to make sure I'm not seeing any signs of infection, so that's good.
Okay.
But I'm glad you told me about the symptoms. Straight ahead. Okay, I'm just going to look inside this ear. No issues here. Okay.
Thank you.
Go ahead and close your eyes. Let me know which ear you hear the rustling sound, your left or your right.
Left. Right. Both. Left. Left. Right. Both.
Okay. I'm gonna give you a couple cents to smell, and we're gonna wrap this baby up.
Okay.
Okay. So go ahead and inhale. What does it smell like?
Lavender.
Peppermint. Not correct so far. Go ahead and inhale.
Orange.
Vanilla. Okay. Go ahead and inhale.
Kiwi.
Okay. Well, that was orange. Okay.
Gosh.
All right. Just one more.
Pumpkin spice.
That was rosemary spice, okay? So I'm gonna write you a bunch of referrals. I think your problems are beyond my control. You have a lot of issues with numbness in your feet. You're not smelling things correctly. You have numbness and tingling. So we're gonna send you to get a bunch of tests done.
Okay.
Hopefully this is just something connected to the foot pain, and it's just kind of throwing off your whole body. But we're going to just make sure, because you have great insurance, okay?
Okay.
So I'm going to write you that referral in the front.
Okay.
You seem to be doing well. You're smiling. I'm glad that the pain isn't taking away your love for life. And please come back. We're going to schedule a follow-up for next week, okay?
Thank you, Katie ASMR.
All right.
Thanks.
Bye.